From the Benson Tower Studio, this is Fox 8 Morning Edition at 6 a.m.
It's 6:16 at this hour on this Friday morning. Louisiana, you may not know, but it's ranked as one of the highest smoking rates in the nation. It's the leading cause of a chronic lung disease. And joining us now with more, Dr. Diana McDermott with People's Health. Good morning.
Good morning, Liz. How are you doing?
Good, thank you. So, chronic obstructive pulmonary disease. That's a long phrase. Tell me exactly what is it, or let's start first with the symptoms of it.
Okay, well, actually, what it is probably a good start because
Okay.
it's a progressive destructive disease of the lung tissue. So ordinarily, everybody's going to lose a little bit of lung tissue as they start to get older, but COPD exacerbates that and accelerates it and makes it so that you lose some of your lung function and your lung volume sooner. And it happens most commonly as a result of smoking.
Okay. And any particular age group that is most impacted by this?
So it's not an age group related thing as much as a how long you've been smoking thing. And so somewhere after around 15 to 20 years of smoking cigarettes heavily, somewhere around 2 packs a day, people start to notice that maybe they're having a cough every morning or they're producing a whole lot of mucus. Maybe they go to an urgent care center, they go to their doctor and they get diagnosed with chronic bronchitis, which is just strictly defined as the increase in the amount of mucus production and feeling short of breath. But what has to come up in the mind of their doctor is that multiple chronic bronchitis diagnoses needs to lead to an examination of their actual lung function. So they should get tested for how well their lungs actually work and then see whether or not they have COPD.
Yeah, there are a lot of studies, especially these days, as to what prompts people to start smoking. But why are the numbers so high here? What do you guys know?
Well, unfortunately, there are lots of social and behavioral things that go along with smoking, and people like to smoke when they drink, or they like to smoke when they're enjoying themselves. You see it a lot at outdoor events. Actually, Louisiana has been excellent about trying to discourage outdoor smoking, and the Let's Be Totally Clear movement has helped a lot with moving smoking out of the bars, which is great for our musicians and great for people who are attending those types of events. But the smoking is the real trigger, and your doctor, especially our doctors at LSU, are happy to talk to people about smoking cessation, which is the first thing that is going to help make your COPD more manageable and decrease your severity.
And people are vulnerable to this. So let's talk about treatment options.
Yeah. So with when you get diagnosed with chronic bronchitis, we usually give somebody steroids and antibiotics, but people don't realize very frequently that there are preventative, or that there are medicines that are controller medicines that can keep their symptoms at bay. A medicine that they can take every single day in order to keep the amount of sputum and their shortness of breath symptoms under control. And so that's a very important thing to get evaluated for by your doctors. And most importantly is stopping smoking.
Right. And just, for those who may say, gosh, I can't stop smoking, how bad is it to be dealing with this on a daily basis?
So the people who say that they can't stop smoking are actually, would they be surprised? We have a lot of tools in our arsenal these days. There are a lot of new types of medications that are out there, and we're happy to talk to people and spend 15, 20 minutes in a visit to talk to them about some very specific things that we can do to quit smoking. Because I'll be honest with you, none of my patients actually say, I love this so much that I never want to quit and I'm willing to deal with my symptoms. They usually say, I've been doing this for so long, I really don't know what else I can do. Can you help me, Doc?
Okay, thank you so much, Doc, for coming in with that and letting us know about that. Thank you very much.